So basically, my name's Helen Clark and I'm the Commercial Services Manager for the Regulatory Services Partnership. We cover Richmond, Wandsworth and Merton. We've done a lot of these webinars for various sectors, and I have to say we've ended up having to start with a disclaimer, which is something we wouldn't normally have to do, but given that the government changes the guidance so incredibly frequently and things are different between the different parts of the United Kingdom, we just always put a disclaimer in to say you do have to take responsibility for checking things yourself on the government website. You can't rely on something you saw last week or the month before, and definitely you can't rely on something that was in place a year ago, because it's very unlikely to be exactly the same now. So we just wanted to make that clear to you. And English law obviously varies from Scottish law and Welsh law. The situation is slightly different in each sector. Okay. Right, so Regulatory Services Partnership. So Maria and I are here today from the RSP. This is a council-owned service. Richmond and Merton joined up in 2014 and Wandsworth joined in 2017. We do have the advantage of scale now, and we have got 100 trained advisors, environmental health officers with experience in health and safety, licensing, pollution. We've got trading standards officers. With regard to COVID, our role, although we are officially the enforcer, we really largely our role is advisory, especially as things are changing so frequently. We, you know, what we see as our role at the moment is to give you help and advice. So today, please don't think that any question is too silly or any question, everyone else will know it and I'll look a fool, because we do completely understand how difficult it is to keep up of all the guidance and the changing regulations as they've been moving forward. Okay, so as I said, I'm Helen Clark. I've also got with me Maria. She has been working on the ground. She's one of the COVID business champions, and she's got fantastic experience out on the field, which is why she's helping me here with any practical advice that you want. So the virus in a nutshell, we just, I mean, people are aware of this already. I know some of this is something you're already quite familiar with, but this virus is spread through the air. And I think if it comes to everything, breaking it down to a nutshell, it's spread through the air. That's where you have to think about controlling it. It floats around. When people talk, they breathe out, they cough, they sneeze, it's an aerosol. Formite transmission, that's from surfaces, is far, far less likely. These slides are one of my colleagues' slides, but he has suggested that there's absolutely no contact transmission acknowledged globally, internationally. There's no, although we're not saying that you shouldn't be keeping things clean, and obviously it's very important to be cleaning things down and wiping surfaces, but the reality is people are much, much more likely to catch it from the air. So where to start? Now, Maria and I have looked through all the guidance, and I have to say we feel very sorry for this sector, because you haven't got your own unique set of guidance. You've got lots and lots of different aspects that all slot in together. So we thought we'd pop on these slides all the guidance that we could find. We may have missed something. And obviously at the end, if there's something that you need and we haven't covered it, please do ask. That's why we're here. So please do feel free to ask. The government has changed the guidance now. Can I move that? I'm going to move that out of the way. There we go. So this is from the 12th of April. From the 12th of April, you can gather above the limit of 6 people or 2 households, or you can gather indoors where it is reasonably necessary to provide a voluntary or charitable service. So for those of you that ask questions about when can I go back indoors and when can we meet people in rooms and when can we hold groups again, you can do that now. You have to do it in a COVID safe way. You have to be, because it's something that you need to do in order to deliver a service, but I think you can do that now. And if you need any help with that, please ask us. So there's specific guidance for voluntary and community social enterprise organisations. There's also specific guidance on volunteering, and there's specific guidance on purpose-built community facilities. I'm not going to go through all these with you, but you've got the web links here on the slides, and they will be circulated at the end of presentation. So if you need any, if you go through the guidance and you can't find anything that you need, just let us know. I've also put at the bottom there the Volunteering Council website details too. Right. Okay, here we go. We've got more. So there's reopening of business and venues. That's a really good one to go through for some very general outline guidance. You've got working safely within people's homes. You've got guidance on offices and contact centres. There's specific guidance on bars, pubs, takeaways. This will apply to you if you run a cafe or a restaurant, or you do catering for anyone in your business. We've put a guidance in on travel safe. We have some questions about travel. That little, this one here, you can see here, this one here is an excellent, really easy to read guidance on traveling safely. And also we popped in the link for Merton. We have 3 different websites. Obviously, we're trying to keep abreast of the Richmond, Wandsworth and Merton website. I would say the Merton one is the most up to date, but the best thing to do is to go to the government website, because that, as Maria checked today, things have changed overnight. So always best to go back to the government. But the Merton one also has some very good guidance on it.
Helen, can I just come in here, because we've had one question come into the chat that refers to the slide before, and I know it is something that other people have wondered about. Yes. It's Mike Derry from Health Watch Richmond. It's on your previous slide, you were talking about the fact voluntary organisations can go above limits where it is reasonably necessary. And he's sort of querying that phrase, because it's the fact of sort of what is reasonably necessary. It's how groups make that judgment about what is reasonably necessary to do. And I don't know whether you have anything further you can add on that.
Well, that is a cut directly from the government website. So I think you have, and sometimes, I mean, I appreciate sometimes it's really quite vague, and when people are nervous about going above that because they think, well, how do I judge that this is reasonably necessary? But it depends on the circumstances. I mean, if he can give us an example of a circumstance, then we'll talk it through with him. But obviously, sometimes it is. And support groups have been able to operate all the way through. And your sector are providing support groups. I mean, there's no doubt that you would fit into that slot of operating a support group. Okay, the RSP have had, dozens and dozens of organisations saying that they're support groups, when in reality that they're not. But actually, if you're doing providing a service, a charitable service for people, then you would be, in a lot of instances, you'd be regarded as a support group. Okay. But thanks, I'm sorry, there isn't. I know. It's not ideal. It's not ideal.
Can I just chip in here, Helen, as well? Because obviously, just because you can doesn't mean you necessarily need to do it straight away. My advice to everyone is to start small and do it slowly and gradually. Get your systems in place, and then obviously build on that. And we will offer a service and to facilitate if that's needed for a particular setting. We are available to do site visits. So just bear that in mind as well.
Thanks, Maria. Sorry, Helen, back to you.
No, go on. It is quite strange. I'm completely blind. Okay. Right. Okay, so risk assessment. So before you, at any point, you need to have a risk assessment, but particularly before you start operating with people face to face. That risk assessment is unique to you, and you need to update it regularly. So when you change your operation, you need to update your risk assessment. So if you have more than 5 staff, it needs to be documented. But in these COVID times, I would suggest you document it even if you had 4 or 5 staff. But basically, that's the law, is that you have to have it documented after 5. There are risk assessment templates on the Health and Safety Executive website. It's very good. It's very straightforward. I've got the first page on the next slide, so you can see that you've hit the right page. But basically, that's at that web link there. You can go onto the Health and Safety Executive website and you can get yourself a risk assessment. Merton Toolbox, and we've got the link on the earlier page to the Merton website. We've got an even simpler risk assessment if you'd rather use that. But the Health and Safety Executive one is pretty good too, which is this. So this is, if you come to the risk, when you press the link to the Health and Safety Executive, you'll get to this page. This is where you do your risk assessment. And it's got like about 20 pages, I think. But it's very clear. It will make sure you cover everything that you need if you work through it logically. The other thing that you will need once you start opening up venues and doing, not face-to-face in somebody's home, obviously, but once you have venues, is that you need to have a QR code. And since the 12th of April, this has been changed. Previously, it used to be one person within a group, but now it's everybody over 16. And that means a group of 16-year-olds, every 16-year-old would need to check in. So even though they're sort of young people still, they have to check in individually. If you have a multi-activity hall, for example, and you've got lots of different entrances or different classes going on, it's worth putting that QR code up on the different entrances so everybody has access to it. Some people won't have the NHS app. They won't be able to do it online. That's absolutely fine. You have a piece of paper and a pen and just take their personal details. That's absolutely fine. So this is what you come to. If you want to create your a QR code for your venue, you have to go onto the website on that link below. This is where you end up, and you can just create as many as you like, I guess, depending on the number of venues that you've got.
Sorry, Helen, it's Catherine again here.
Yeah,
we've got a couple more questions coming in. It's a question of whether I interrupt you when you're in your flow.
No, it's fine. I like, I'm blind, so
I know you said you wanted that. So first of all, we have one, just a quick one, hopefully from Charity, who works for Hands, which is one of our local neighbourhood care groups. She was talking about the risk assessments, and you said above 5 members of staff. Is this specifically paid staff, not volunteers?
It includes volunteers.
It would include volunteers.
Right, so it's just above 5 people. But as you said, it's better to document it anyway and do an assessment.
I would suggest, I said, look at the Merton one that's very simple. Maria, I think have you created that one, Maria? We've done a very simple one.
It's to make it, it's more of a read and you fill in as you go. It is really simple. So if you're a small organisation, it might be better to look at that one. Just go to the Merton website, put in COVID toolbox and everything crops up, including posters, all sorts of things. The latest links to guidance, everything's there.
Okay, there's a question from Ian, which I'll come back to later, actually, because it's not quite relevant for this bit, but we'll pick up on that later, Ian. One from Anne Speak at Richmond Good Neighbours. She's just asking if a group is using someone else's building, for example, a community centre, do we assume that they have done the risk assessment and have the QR codes in place?
No. Every organisation will have to do their own risk assessment if it's complete separate entity, because the risks will be different. The QR code, it can be the same, but there will need to be one at each entrance. So you can share the same QR code as the main. If you wanted to have a different QR code for a different activity, that's fine too. We just want to make it as simple as possible, so whatever works really. But you have to have the conversations with the person running the building and make the decisions where you're going to have the entrances and work it all through risk assessments, etc.
Right, and then Colin Cooper from Habitats and Heritage, environmental organisation, that he's asking, would people still need to check in if the activity is outside?
Yes, they still need to check in if they're meeting socially in a group. They would need to check in. Yeah.
Okay, and then
if you think about the restaurants now, you're checking in and everyone's sitting outside, so it's much the same.
Right, and actually on restaurants, Vicky from Museum of Richmond has commented that she says it's worth highlighting that people can opt out of she's saying the test and trace, only restaurants etc. can refuse entry. So I know they will let you say you can't. I think that's to do with the QR codes, obviously, that restaurants will say if you're not willing to play the game, is how I saw one restaurant term it, then they can refuse you entry. So presumably that means organisations could also refuse entry to people who weren't willing to use the codes.
It only mentions hospitality in the legislation and the guidance, but obviously it's an individual organisation's choice. But no, it's only for the hospitality that is specifically mentioned at the moment.
Okay, and then they're coming in thick and fast, so we might have to pause on the questions in a moment so you can carry on with the presentation.
That's fine.
But Alan Davidson's asking, who is responsible for ensuring people are checked in a multi-use centre?
Everyone is, the main organiser would need to check their in, but also the individual activities as well, because it depends, they might have a separate entrance. So each organisation is responsible for their participants that they've logged in.
Okay, thank you very much for that, Maria and Helen. Right, Helen, back to you.
Okay, we're moving on. Right, okay, so just going back to the ventilation thing, I don't think we can emphasize enough really. This is your top priority, is to get the airflow through at the moment. So opening your windows, open doors, increase your fans, whether you've got air conditioning, turn your air conditioning up. That is what, once you go indoors, that's going to be your priority. Okay, so 1 to 2 meter mitigation. Now mitigation at the moment, we still have the social distancing, which is 2 meters or 1 meter with mitigation. This, I know that the government is reviewing this, but at the moment this is the situation, and that's the rule as it is at the moment. And I imagine it will still be the same when it gets to the 17th of May in the next tier of, we reach the next step 3. So mitigation very much depends on your circumstances. So you have to look at your own individual, this would all be part of your risk assessment. So you can mitigate by seating plans, you can space people out, you can have a seat in between closed off, you know, put a bit of tape over it. You can screen, you can mitigate with face coverings, you can mitigate by cleaning, you could separate by time, you leave a space of time for the air changes within a room before you get the next group in. Ventilation is mitigation, and of course being outdoors is the greatest mitigation, because being outdoors is significantly less risk than being indoors. Any questions on mitigation? Okay, I'm going on. Right, so here we've got just a few examples. So here is a cafe, and they put screens up between the tables. That's you know, perfectly acceptable as far as we're concerned. You've got a screen between the tables. This is obviously you're screening off to keep people separate, so you're just not allowing people to mix within a space. This is obviously from the beauty sector. This is a nail bar, but you can see it's similar principle. They've got screens up between the chairs. Right, moving on, face coverings.
Sorry, Helen, there's just one that's come in, which I was half expecting, and it's Louise from Cruise Richmond who has asked it. You mentioned about mitigation factors and saying leaving time. And of course, the question is, how much time should be left? If you're saying about leaving a room vacant between sessions, for example, is there any guidance given on that?
No. Maria, do you know of any guidance on that?
There isn't guidance, but obviously it depends on the size of the room, how much ventilation you've got in it. So obviously the more the better, but if you were just to do a 10 or 15 minute quick purge, it depends on the size. If you've got great ventilation, it'll probably take a lot less. But yeah, it's very subjective, but obviously you just need to risk it yourself and think, would you think it's had enough air circulating, changes of air before letting the next person in?
I know, I mean, I've been going to the dentist quite a lot myself recently, sadly, anyway, and they've got like a 20-minute gap between all the patients.
Right.
But obviously, yeah, it depends on the room. If you can open up all the doors and windows and then leave it 10-15 minutes and then you get the next group in, that's much better than, you know, back to backing your groups.
Thank you.
Okay, right, so face coverings. So the PF2 mask is the one, is like the one that's accepted as giving good protection for an employee or a volunteer. But actually, any face covering will reduce the risk. Now, face shields, I know people will have seen face shields being used, and they are quite good at protecting, well, they give some protection to the person who's receiving, but they don't give very much protection to the person wearing the shield. So they don't stop the tiny aerosol droplets, and they don't stop staff breathing in small airborne speech droplets. So they do not replace the need for face coverings. If you're in close contact services, you might want to use both, but you shouldn't be using a shield on their own. With regard to gloves, it's quite similar, I think, to the food hygiene analogy. You know, if you've got people catering and you are asking them to wear gloves, it's to keep, obviously, to stop people getting something on their hands. But if you just wash your hands regularly, that does the same thing. So it can give a full sense of security. It's not a problem if people want to wear gloves, it's absolutely fine, but it's not something we would be insisting on. Right, testing. I'm sure I'm going to get lots of questions on this. So testing is available on the government website, and it's also on the London Borough of Richmond website. There will be access to how you get your tests. A lateral flow test gives you a result in 30 minutes. It's a bit like a pregnancy test, and it's a really good indicator as to whether or not somebody's got COVID. I think it's about 85% accurate. If you have symptoms, then obviously people should be staying at home, and then at that point they should be getting the PCR test. But if you are looking to check your staff to see, just on a regular check as to how they're doing, as to whether they've got COVID, just for your own security, then the lateral flow is perfectly fine. And you can book your lateral flow now on the government website. You can book yourself 2 lateral flow tests a week. Either, I think you can do that through as an organisation, but you can also do it yourself. So you could ask your volunteers to book their own tests online. We've got any questions on testing?
Not yet, but I
Not
think
yet.
I'll probably, let me just see, there's something coming in from Naomi Passmore. Is there any access to templates for testing policies and or consent forms, as we will be offering workplace testing, picking up for home testing, and would like staff to report results to us as well as the government website? Naomi's from Richmond Borough Mind.
I think, I mean, I don't think it really matters how you record it. I mean, you get a test result through on your phone, don't you? With a lateral flow, I'm not sure whether I don't know whether I haven't had a lateral flow myself, to be honest with you. But with the PCR, you get a result through on your phone or an email, and you just would forward it on and take a note of it. The
PCRs I know are more official. I think the lateral flow test, I think you do it yourself as such, so you'd know the results. And I suppose it's a question of, yes, whether, you know, staff, whether they have an obligation to report the results to their employer, whether there's any guidelines around that, I think is what Naomi is saying.
It would be part of your risk assessment. Again, it's part of your risk assessment. So if you create your own policy that suits your organisation.
I mean, you could get lateral flow in for some volunteers to do it there if you wanted to. That's not a problem at all.
Yeah.
It's up to you to develop that policy, but everybody now is able to do it twice a week, every member of public, so it's out there available for everyone.
Right. I mean, if you feel, obviously it's more secure if you have somebody do a lateral flow in front of you so you can see the result, but if you're happy for people to do it at home and report in, you know, they have an obligation to do that. That's they're going to be fraudulent if they give you the false results, so I don't think that would be a massive problem either.
Right, so linked to that, then Simon Lawson from Citizens Advice Richmond is saying, do you have to supervise your own staff or volunteers doing the test? So the answer to that is no, so thank you. Louise from Cruise Richmond just checking whether you need to do the lateral flow tests if you've had both vaccinations. I think you do, she says.
You do, yes, you do. And I know, well, that's what we personally think and what the government is telling us to do. And so, yeah, I think we have to do that until we're told otherwise.
And then Sheila Wookie is asking, can we require volunteers to do lateral flow tests or just recommend it to them?
I think you have to think of your volunteers in exactly the same way as your staff. So if your staff have to do a test, then your volunteers have to do a test. Right. Because you're looking at a risk assessment, and if assuming that they're doing the same, you know, the same sort of role, so it's more a question of what the role is as to whether they need to do the test.
And you're trying to prevent an outbreak, aren't you, really, if it's sort of spreading amongst all the people together. So Simon Lawson has come back in the meantime to say he thinks that getting tests issued by employers, he thinks it's, sorry, I'll repeat that. I think the condition of getting tests issued by employers is that you do have to supervise them. So that might be something that needs to be checked, perhaps, as to what that guidance is. Unless
Maria, and I'll go back on that one. I mean, it would be better. It's obviously more secure if you do get it, if you're supervising the test.
Yes.
Up until the 12th of April, you could order tests for businesses, but that's come to an end now. Yeah. So you would have had to already register to get that sort of the test sent to you for that. So that's already gone. So that might have been linked with that.
It depends on the sort of. It depends on what you're doing. I mean, you know, Maria and I are working for the council, and our tests are not being supervised. We're not doing lateral flows twice a week. So you know, depends on the risk of
Helen, I am doing lateral flows twice a week, but I go
to
I go to a pharmacy twice a week.
But we're not. It's not compulsory.
Yeah, no, but because I'm frontline, I do it twice a week for me to be safe and for everyone else that I'm exposed to be safe. But we do it at a pharmacy. So
you're not supervised. Well, you're supervised by.
We are, because the pharmacy does it. We do it ourselves, and then they do the test and give us the results.
Oh, there we go.
Yeah.
So you see, that's why I brought Maria with me.
Right, and David Bowman has written in the chat that lateral flow tests do not require supervision, and he's saying that local school staff now have home tests, test kits, and the lateral flow tests are voluntary. I know individuals can now request a pack to be sent to them. I think you get about 10 tests. There is that issue, as Maria was saying, because if businesses didn't register by that 12th of April date, it's hard to get mass amounts of them. But and again, Anne Speaks just saying from Richmond Good Neighbours that they suggest volunteers do the tests, but they're not supervising them. So yeah, okay, right, we're going to carry on with your presentation.
We're going to carry on. I mean, I think yeah, if you have any questions, we'll do some more research on this. But as I said, the issue is things change quite regularly. But it's not something that we're going to come down as very heavy on. You know, it's not something that we will be coming out and criticising if you're not doing something because you thought you were doing the right thing and then the government's changed the guidance and you're now doing the wrong thing, or you're not doing something. It's not that sort of regime. So I just don't want people to be incredibly worried about the fact that they might do something wrong because they haven't quite understood what's required and something has changed. That's, I suppose, what we're trying to say. Right, mental health. Just moving on to mental health. We need to be very mindful of looking after ourselves. It's been quite a difficult year for a lot of people, and also look after our colleagues and our volunteers and people that we work with and our clients. And this is just incredibly important as we're moving into another period of change. Some people are very nervous about going out. They're still very nervous about meeting other people, leaving the house, having somebody in their house. So we just put a couple of links in there for mental health, because we just think that should be also part of your risk assessment, something that you need to consider when you're looking at all the other issues around COVID. We want you to think about mental health too. Vaccinations, right. I'm sure I'm going to get questions on this, and I hope I'm going to do a bit better than the lateral flows. Right, okay. So as the vaccination program is rolled out, people will be at different phases depending on their age and their other factors. We would recommend that you ask your staff and volunteers if they have been vaccinated. We, as local authority employees, are being asked, have we been vaccinated? And you can incorporate that as part of your risk assessment process. But we have had questions about vaccination. You cannot insist. I mean, this is quite obvious, one would have thought, but you cannot insist on anyone getting a COVID vaccine. But I think you do need to reflect their vaccination status in the way that you deploy them, which is a slightly different thing. So basically, you can't insist that they get a vaccine. You may be able to consider this when you're looking at bringing in new staff, but you definitely can't insist that somebody gets a vaccine. And absolutely, you can't get rid of somebody because they won't get a vaccine. But if you're looking at that you need somebody for a certain role, then it could be a factor. So hopefully that's made sense. Have we got any questions there, Catherine?
Not yet.
Not
Question
yet.
Of how quickly people can type. I come back to it at the end, I think, because I think there might be some.
There may well be some questions on that. Okay, so we were now going to try and run through the questions received in advance. I'm going to stop sharing my screen now so I can see everybody. And then after the questions in advance, we'll go through anything that's put in the chat, but we're sort of covering that off as we go, aren't we, really? Okay, right. I can see people now. So Maria, do you want to go through, have we got any questions that we've missed off of the ones that we had that came in?
Can you read out the questions? I haven't got it to hand.
Right, okay, here we
Sorry.
go. So the first one is, of the issue of staff or volunteers who've refused the vaccination, if their role is with vulnerable people, should they be redeployed? I mean, we talked this through. If you can redeploy them, we would suggest that you do. But you definitely can't, as I said, you can't.
Well, as part of your risk assessment, you've got to look at everyone's vulnerabilities. You've got to look at anyone that might have been shielding, anyone that's extremely vulnerable, the age group, and then obviously determine sort of the roles in relation to the risk. So, I mean, obviously it's such a wide range of services that you're offering. It's really hard to be specific here, but come back to us with any queries. If you need any specific help, please do come back to us. But you do need to do your COVID risk assessment first of all, and that will identify any issues in terms of where people should be working and where people shouldn't be working.
Okay, right. For organisations who are transitioning back to working on site, how can they deliver or adapt delivery of face-to-face services? So we talked about this. You could already have an office open. You can already run a support group. As Maria said, if you have ceased all face-to-face contact, it's probably best to phase that in slowly and to build it up gradually. And if you need some help on that, please let us know. We've got somebody has asked, Crews have asked about resuming one-to-one support. Is somebody from Crews here?
Yes, I know Louise is here because she's asked some questions. Louise, I don't know, I think maybe Ellie might be able to unmute you if there's something specific you wanted to ask that hasn't been covered.
No, not really, thank you. It seems to be coming up from the other questions and the idea about how long you have the room free for and how you ventilate, so I'm kind of happy with that. Thank you.
I noticed you did put something in the chat about wanting a link to the Merton toolbox. I think that'll probably hopefully be picked up at the end.
Yes, please. I couldn't find it easily on searching, so that would be fabulous. Thank you.
Okay, we will.
Thank you.
Well, Maria, you can type it in the chat. Can you type it in the chat, Maria?
Yep, I'll look for that now.
Okay, when will council run spaces be opened for community groups? Well, I think we have somebody here from facilities, so probably would be best for them to answer that question.
Nell, is that something you might be able to answer?
Yes, hello everyone. Sorry, I'm trying to turn my video off. On even. Hello. Yes, I think different spaces are opening at different times. A lot of them were open in part throughout, and just made sure that those places are COVID secure in terms of signage and cleaning, and have risk assessments and the QR codes in place. So we've also been making sure that all the water checks and any disinfectants and things that are needed, disinfections through for Legionella water hygiene, all of those checks have been ongoing throughout the limited occupation of the buildings. So I've got a whole list of sites and what's been done where. So if anybody's got any specific questions about certain buildings, I'm quite happy to answer those.
Somebody just asked about Sheen Lane.
Sheen Lane, yes, I think particular organisation, they couldn't get access to the room that they currently use because of the LFP testing. That testing is still being done there, and Kevin Power, who had kind of in.
Oh, we've lost Adele.
Oh, she's got link issues, I think.
She has.
I think Adele's on pause.
I think from the sound,
I think
Sheen Lane is still a work in progress.
It's Sarah from Health and Safety. What she was saying is that Kevin, that we're still trying to identify how long the lateral flow testing is going to be taking place at that site. Once she gets that information, then they'll be able to plan when it can be reopened once it's not being used for lateral flow testing. And just back to another point, lateral flow tests, and people can order them online, they can pick them up from pharmacies, so anybody can get hold of those tests, even if they're not being done unsupervised, as you mentioned. So that any member of staff or member of the public can get access to a test now. The lateral flow ones, the rapid tests, they're accessible to everybody.
Brilliant. Thank Thank you, Sarah. I don't know whether Adele's come back, but just on the subjects of property, then Karen King from Ham SOS has asked about Ham Library community space and any news on reopening to community groups. Sarah, do you happen to know about that, or would that be a question for Adele?
I think Adele would be able to confirm the exact timescales, but that from what I understand, after the second half of May, hireable spaces will then be reopened and reconsidered for booking. So after the next thing on the roadmap, basically.
17th of May.
Back to you, Helen, on those.
Okay, right. So I've got
others in the chat to go through.
Sorry, the Friends of Queen Mary's Hospital have asked about second-hand book sales on a trolley. We wouldn't have any issues with this as long as it's in a COVID secure location. Is it? I'm not sure whether it's in a charity shop, which obviously they can be open now, but or in a public space. That's fine. Is there somebody there from Queen Mary's, Friends of Queen Mary Hospital? I mean, you would want.
It's Anne Thicket. I don't know if Anne's here. Anne Thicket.
But it just would be treated as any retail. So it's much the same, although it might be free, but it's still treated in the same way. Support for elderly and isolated involvement. Hands, Help a Neighbour in Distress scheme. Is there somebody here?
Yes, Charity's here from Hands. She's actually got a few questions in the chat. So perhaps, Charity, this is your moment to come, if you can be unmuted, to maybe ask your question, because I'm aware you have been asking some. I was going to come back to them, but perhaps you want to ask them now. Are you there, Charity?
Thank you. I think my health will answer. I had. Oh, can you hear me?
Yes, yes.
Can you hear me?
Yes.
Okay. Health Watch has answered my GDPR question, so I think I've frozen again.
Do you want to turn off your camera, Charity? Because I think maybe
so that's all. Yeah.
And try now. Might help.
Any better?
Yes, can hear you a bit better now. Thanks. Yes.
Right. GDPR question has been answered by Mike Derry, so thank you. I was going to ask a question specifically about opening up transport for our vulnerable elderly clients in our volunteers' cars. That's something we're considering starting soon, just to get a balance of whether this is OTT or right. If we have windows open before they then would ask them to wipe down handles and steering wheels with anti-back wipes, wear masks, sit diagonally in the back if possible, and that would be. And occasionally people are going to sit in the front next to people because they can't get in the back of a car. Then it's just windows open, masks on, and that's as sensible as you can get, I think. Is that correct?
Yes, no, that's correct. And it reflects the guidance that's out there already for transport and taxis, etc. So yeah, no, that's good practice. One
of the links in the that I covered earlier is for transport guidance, and it's really good, and it's also got very clear pictures. And exactly, they have a picture of that. There you go. So yeah, perfect.
Okay, thank you.
Balance. Now, this is from integrated neurological services, balancing the needs of clients and staff in a blended service provision. I think I need a little bit more information as to what help you need there.
Okay, so this was Anne Gowan, I think, who asked this question when she booked. Is Anne here or anyone else from INS? You might give a bit more on that.
Recruiting new volunteers post-COVID. I mean, that you just would follow the normal recruitment process.
Okay, well, I think maybe there isn't actually anyone here at the moment, Helen, so perhaps carry on.
Okay, guidance on health and safety around events. I think that I'd quite like to know what sort of events they mean, really. So that was action attainment.
Sam Silver. Sam, are you here today? For something specific you wanted to ask?
There is specific guidance on events.
Yeah, I think that's probably come through from Tom, who's our project manager. And I'm assuming that Tom's thinking about transition talks, which we would be planning to run in the autumn at Roehampton University, with an option of either Zoom or in person.
Right.
So I think Tom's asking about that.
We said I didn't ask that. Something in the chat. I didn't ask that. But yeah, I mean, there is specific guidance on events. I would say, from Maria, once you get to that, I mean, from the autumn, I think we're going to be fine anyway.
From step 3, I think a lot more is available for people in terms of events, and up to 30 people for gatherings other than weddings and funerals and wakes. So I think that would be where things come in, where you can go back into indoors and more outdoor events. So stage 3, that will be from the 17th, not before the 17th of May.
Okay, thank you.
And you'll have that option of spacing people out. Yeah, that sort of event is.
I mean, outdoor events, small outdoor events can happen now. Things like small fetes or something, as long as they're all outdoors. So it just all needs to be risk assessed anyway. But come back to me, please. If you've got any queries, please do come back, and I'll specifically help you with your challenges.
I think we have got Anne Gowan from INS. She sent a message. I'm asking her to unmute. I thought I was co-host and I could do that, but I'm not sure I can. But I think you're just Anne in the list. So yes, I might not have the power to unmute you, Anne.
Sorry, this is Ellie. Anne has received an invitation to unmute, but she needs to accept the invitation.
Thank you, Ellie. So Anne, are you able, Anne Gowan, are you able to?
Thanks very much. Sorry, I've forgotten what the question was now.
I've got to go back to it as well.
It was around blended services, wasn't it?
Blended services, yes. Yes, balancing the need of clients and staff in blended service provision.
Yeah, and you sort of, I mean, you gave an answer. I mean, I think it's more that people are in different places as regards how comfortable they are and how confident they are. And I was just wondering if there was any shared experiences. At INS, we seem to have accomplished this very well, I have to say, so far. But as things move forward, it's also useful to know, I think, what sort of space clients will be in, I think, and how to cater for those more effectively, and just sort of sharing some experiences would be helpful, I think.
I mean, I think, you know, from this meeting, there's obviously will be some merit in it. I'm sure this goes on already, Catherine, but in some sort of groups for people to discuss what they've done and where they're going, and, you know, there's a lot of shared knowledge here. Probably way beyond what Maria and I have got, because that we're not in this sector that often, to be honest with you. Our main experience is in retail, hospitality, you know, the high streets, far more than in the charity sector, which is something that the regulatory services don't tend to get that involved with normally. But we found through COVID that we have been interacting with a lot of different sectors where we normally there would be no need for any regulation. You know, they're very self you know, independent, and we don't know, there are no issues around it. So if Catherine can sort of set up some support groups and some meetings where people can discuss what they're doing, what they plan to do, I'm sure there's a lot of experience within this virtual room that people can help each other.
Thanks, that would be really helpful. I think that's more my sort of theme, really. So yes, thank you.
Yeah, certainly. We have had a couple of those going on with the community centres network and CEO network, but we'll certainly look at seeing something else, because I think, as we're seeing from the chat, people are putting in things that they've learned. So definitely agree. But this is, I think, a really helpful starting point in terms of the legalities and what people have to do, and then things can grow from that. So it's really helpful. Thank you. Helen, if you want to spend another 5 minutes or so going through any of those pre-submitted questions, because then we've got quite a few in chat to come back to.
Oh, as gosh, okay, all right. So, well, we have another question on Sheen Lane, which I think we've sort of covered now, haven't we? We're waiting on the lateral flow and Kevin Power. Right. Clarity on different timescales for permitted indoor activities at community centres. As we said, there's more will be permissible from the 17th of May, assuming that date goes ahead. I think it's every likelihood that it will go ahead now, but and then the next date is in June. Guidance on minibuses, I think that's, as I said, the distancing is still the 2 metres and 1 with mitigation. And that guide we put on transport is very useful too. Where can we relax on, I think that one we've covered already on transport.
Just one thing to add on transport. My colleague, Julie Gavin, has put some updated guidance, because it was updated last month, the Community Transport Association guidance. So people might want to have a look at that if it's an area that's relevant to them, because as you were saying earlier, Helen, things get updated so frequently and it's not always made public when they're updated. So that's something she's noticed. So that has been put in the chat as a link, and hopefully it can be shared afterwards as well.
I mean, we as regulators are watching on the news like everybody else, I can assure you. We have no prior update.
We just get the biggest tip that I've found. So I've got the COVID-19 app. I don't know how many of you have. If you go into the latest guidance, it updates it automatically. So on the app, that's where I get all my latest guidance from. That's the biggest tip and a help that, you know, if you want to get the most update, that's where you go. Don't go Google searching, because you don't always get the right thing. So you go into latest guidance on the NHS app, and that's the best bit of advice I can give anyone.
Thank you, Maria. That's handy.
Now, somebody has asked about English as a second language. That's learning English at home. And it's true that because things are moving so incredibly fast, it is largely in English. I haven't seen, some things are translated in different languages, but a lot is not. But some guidance is in a very simple format. Maria was saying at the bottom of some of the guidance.
Not all the guidance, but lots of the guidance. If you go to the bottom, it's got sort of simple version, and a lot of it's pictorial, and it has ticks and crosses, and it's very visual. So it might be good for people with learning difficulties, or people that don't speak English as a first language, or just want to have a quick pre-see without having to read through everything. It's really good.
Okay, are we back to normal from the 21st of June? Who knows?
Who knows?
Sorry. We hope so. We really hope so, but we don't know. Interested to hear from others, what others are doing. Well, there we go. Somebody else is also very keen to have like another workshop following this one. I think that is obviously a message that's coming out here. We have operated during the pandemic. It will be good to hear what other adjustments have been made. Face masks inside. What happens if you're accused that you allowed somebody not to wear a mask inside? There's still, you can't insist. If somebody says they have a dispensation, they don't have to wear a mask, you can't refuse them permission to come in. That's the that is,
and they don't have to, and they don't have to produce exemptions.
They don't have to. No, they don't have to have written. You have to go on their word. The requirement's different from the 17th of May compared to the pre-Christmas period. It is different, but we haven't got the guidance yet on the 17th of May, so we unfortunately the government guidance comes out very late, normally a day or so before. So we don't know exactly, but all I can say is it won't be exactly the same, because it's been different with hospitality. The things have changed, so it will be different. Homeless people, I'm not sure if there's anybody here who wants to ask a specific question on that. I think maybe put that in the chat, because I haven't. Step 2 guidance for opening community facilities. Why didn't we receive it earlier? It's down to the government, unfortunately, not down to the local authority. Street collections, they can go ahead. If you want to do street collections, that's absolutely fine. You're outside and you'd have the same transport issues that we've discussed earlier. Reopening of a very small museum. This is Twickenham Museum. Is anyone Twickenham Museum here? So if anyone wants advice on a particularly unusual space, then it's definitely better to get somebody to pop down and visit, rather than us talking in generalities, because we would need to look at the actual space. Okay, will catering arrangements be permitted at social events? Catering, you would be just following the same line as for hospitality. So if you look at the guidance on hospitality, pubs and restaurants, it'll be the same within the charity sector as it is within the hospitality sector.
Outdoors at the moment and indoors from the next step.
At the moment it's outdoors, indoors from 17th of May. Okay, so I'm done.
Thank you, Helen. That's all the questions we had before. There have been a few more coming into chat, which we will now go back to now. And you and Maria are doing a great job. And if any other colleagues want to chip in with that, just one that came in very briefly now, because it relates to street sort of fundraising. Someone, Gillian from Mortlake Community Association, is asking if they can do street consultations. So I presume that's asking people questions. Is that similar to donations? That's something that would be allowed?
It would be allowed, but obviously I would still encourage face coverings. Obviously, is it to raise money? I
don't know. She doesn't say. Gillian.
Yeah. Well, it's outdoors, so it would be allowed, but obviously just take precautions. I know outdoors technically you don't have to wear a face covering, but I would advise that they do.
Okay. No, she's confirmed it is around consultation, but yeah, so it sounds like face coverings are the way. Right. Helen, you mentioned there was a question that had come in before around homelessness and homeless people, but there wasn't a lot of detail. I noticed it came from Ian Hadlow, who I know asked an earlier question, which I was going to go back to, which may have been answered because it was about restrictions being lifted in June. Ian, did you want to ask any of your questions as such at this point? You hopefully will get an invitation to unmute.
I have got an invitation to unmute, and I've unmuted. Yes, I'm the steward at Barnes Methodist Church. And as you notice that we're probably, we resemble a building site at the moment because we're having our roof done and we're having a bit of internal work. We have an awful lot of businesses use our premises downstairs. They're not going to be using it until the middle of May, okay? But what we do every year, we let our place out free of charge to a homeless charity called Glass Door. And from every Saturday night, from the beginning of November through to the beginning of April, they have our property and they can actually house up to 42 individuals who are homeless. They get bussed in, or sometimes they walk in. And they walk usually, and they get bussed in obviously over Putney Bridge because of Hammersmith Bridge now. We may get changed circuit, but that's by the way. But obviously we haven't had anything since when I did the third week of March last year. Obviously this winter's been a blank for us. We provide them with a meal and we provide them with a place that's safe, secure, hopefully, for them to sleep in, and they're up and out at about 7:30, 8 o'clock on the Sunday morning, and the place is cleaned before we can walk in. Will we be able to do that? Who knows? Come next November. And my question was, and it's been said before, will we be somewhere back to, I hate the word normal, but will there be no boundaries as there are now, hopefully from July onwards?
$1 million question, eh?
No, yeah, we can't tell you, because we don't know, when we will be back to normal and what normal will be. But you would have thought by November we'd be very close to it.
Yeah.
But you will have to wait till a little bit nearer the time, I think. And we don't know.
The reason why you've probably not had as many homeless is because obviously the government priority has been to help the homeless during this pandemic. So a lot of them have been housed and brought into hotels and various bits. But that probably will come back, that need, for sure.
Yes, I know they are too. They're in the so-called Airbnbs. That's where they are. And they're also, if you go up Shepherd's Bush Road towards Shepherd's Bush Green, there's a lot of these sort of old, sort of like Georgian type houses that are very cheap and sometimes nasty B&Bs, and they're in there. And the people who own these are at least getting some form of money from actually doing it. They're not donating them free gratis, I can tell you that. But no, we observe all of the actual, we're back now at church once a fortnight. We started back Easter Sunday. We finished on Christmas Day and we started back Easter Sunday. And we're there every fortnight, first and third week of every month. And we take all the precautions. Yeah. I mean, it's quite cold in our church with all the windows and doors open. There's so much ventilation you can't believe. Plus the fact that we've got a very flimsy roof at the moment as that's being replaced. How we're going to pay for it, well, God knows how we're going to pay for it. And hopefully we'll seek guidance from him to how we're going to pay for it. But everything is fine at the moment. We do everything, I think, that is humanly possible.
Okay, thank you.
We'll just keep posted and we'll come back to us nearer the time if there's any outstanding queries.
I will. I have to go now because I've got my gym's back, so I'm going to my gym.
Very much, Ian. Thanks for joining the meeting.
Thank you.
And enjoy your gym session. So yes, I mean, there was another question sort of related to that. And again, I don't think it's one you can answer. It's related to that uncertainty issue. Naomi from Richmond Borough Mind was sort of asking about whether things will return to normal post 21st of June, restrictions lifting, particularly around social distancing, because it's around helping them with planning what size venues they will need to use. And she says she's seen conflicting advice on that. I don't know whether you've anything to add really, apart from what you've already said. Really, it's very much a wait and see for everyone, unfortunately.
Yeah, it is, and we know that event planning is incredibly difficult for people, and people have just cancelled lots and lots of events because they don't want to take the risk. But unfortunately, no, Maria and I can't give you an answer on that.
Okay, yeah, so we'll just see how things go. Right, I noticed there were some earlier questions going back to around vaccinations, around if people refuse to have a vaccination, or perhaps even declare that whether they've been vaccinated or not, whether, can't find it, it's Linda Hantz. She's asked, is it allowable to change a person's role to one that's not directly dealing with vulnerable clients if they refuse to have a vaccine?
Yep, as part of your risk assessment, that's what you should be looking at. So absolutely, if it's too unsafe, then yeah, redeploy them or put them somewhere else where it's much more COVID secure.
Okay, thank you for that. And then Simon Lawson, again related to vaccines, is saying some of our staff and volunteers are asking whether others are vaccinated before they attend our offices. So yes.
You can't insist on that because the rollout's different. It's not fair for some people that just can't get it just yet.
Yeah, I think people need to be just a little bit aware of who is now vulnerable, because obviously the older generation, well, people over 45 now will have had one vaccine or have the opportunity to get one vaccine. So actually, it's the younger people. I mean, we've been out checking the reopening of the high streets, and where you've got a very large number of young people together. They are actually more at risk now than some older people. So but this is changing so quickly that in 6 months, well, less than 6 months, hopefully, all the adult population will be vaccinated, and then you have to think about it again. Which is why the risk assessment has to be so dynamic. You have to reflect back on it and change it to update as the situation changes.
Right, thank you. Now, Jenny from Learn English at Home. Now, you mentioned Jenny earlier, Helen. I don't know if it was her question in the chat you were talking about, or one that she'd submitted before, but Jenny was asking, well, Jenny, do you want to speak actually? Because just to hear from some different voices. Jenny Irish from Learn English at Home, did you want to ask your question? Because that's about going into people's homes.
Hi, can you hear me?
Yes.
Hi, yeah, so we volunteers go into the homes of clients usually and teach English on a weekly basis. So I was thinking, with lateral flow, vaccination confirmations, good ventilation, is that something, you know, with the guidance of working in people's homes, that we'll eventually be able to go back to?
Yeah, we talked about this. We think you can go in now to somebody's home.
It depends on the service, doesn't it? If
Yeah,
it's something that's really essential and needed, and also if they might be able to form a support bubble with you, there's obviously ways around it as well, as long as you're safe. But could this be done outside in a garden, or could it be done outside the language? Could it be done somewhere a bit safer?
In some cases, but from the side of the client, in terms of checking if people are, you know, have limited English, that checking on the other side from the client side is more difficult potentially. So just something for us to.
Well, certainly from the 17th, step 3, it will be absolutely fine. But I think as long as you're looking at the risks now, then maybe you can do it in another way.
I mean, obviously, it's tricky if you have to wear a mask and you're teaching English. You know, that's going to be
exactly
quite difficult. Yeah.
For social distance and outdoors would be preferable.
Yeah.
Okay. Thank you.
Thanks, Jenny. Right, Rob McRae Adams. He's at the Greenwood Centre, which is managed by Hampton Hill Voluntary Care Group. He's asking about the fact that their centre is used as a vaccination hub for the local primary care network. So they've got high volumes of people coming in. What are their obligations for the test and traced for those visitors to our centre? Should they all be, I presume, I don't know, Rob, do you want to add anything to that? Or is it just as simple as that? What are your obligations for test and trace?
They should be doing that now anyway. Anyone that's coming on for volunteer, they will have a record of who's working, who's volunteered for test and trace. Anyone that's in an indoor environment would need to keep records.
So, but if they're just coming basically to get their vaccine, does someone who's going in there to do their just come in to have their vaccination and then leave again? Would
they would need to check it. I mean, we don't check in now for vaccines, but if they're coming in to use toilets and other things and other parts, then it depends on what they're doing, really. If they're just coming into the vaccination and it's an offshoot, then no. But if they're coming in to use the facilities, then I would say yes. Depends on how you get to the centre. I think it's safer to have them checked in than not, really. But if it's a separate entrance and it's completely separate from the other, then probably not, because we don't check in now for vaccines.
I mean, if you're going for a vaccine, then there's a record of everyone who's attended for their vaccine, so you are effectively checked in.
Yeah.
You know, you're traceable. The whole point of the QR code is so that if you had an outbreak, you can trace people who were at that location at that time. And you can
I think that just clarifies the situation. It's obviously they're keeping their records from the GP hubs and that sort of thing. I just wanted to make sure that there was no extra requirement. If they're just simply queuing for their vaccination and out the other door.
That seems pointless to be trying to
unless they're coming in to use the toilet facilities or anything else, then yeah.
Okay, that might be a little bit of a grey area, because occasionally people might, but that's very difficult to manage.
Exactly, it's going to be less than 15 minutes, isn't it? It's going to be less than 15 minutes.
When we open up for more use of the centre, then we'll have those people by track and trace, but the people coming through the actual vaccinations, it's okay, just the process with the GPs. That's what I just wanted to make sure.
I think so. As I said, I think the whole you have to go down to the basic principles. What are you trying to achieve? And you need to be able to contact these people if there's an outbreak, and you can. So
that's good. That's cool. That's reassurance needed. Thank you.
Thank you very much. Robin Gammon has asked, he's saying, I'm a venue manager for a church building. Some hirers are technically businesses, for example, Slimming World, working to a smaller group size of up to 25. He's asking if they're able to return as of now, say from the 12th of April, or presumably where they'll need to wait till the 17th of May.
Yes.
17th, or unless it's a support group, which is more mental health support, etc., then that will be up to 15. So yeah,
so really it's probably going to have to wait till the
17th. Yeah,
right.
But they would need to do their own individual risk assessment to reopen anyway, that group, so they can identify a number, because just because you could do numbers, your room might not be fitted out for 15, or you have to look at the room size and what's safe to socially distance still, and what the ventilation's like. So just because you can have a certain number doesn't necessarily mean you need to have that number back in.
Okay, thank you for that, Maria. Right, Laura Irwin from Museum of Richmond is asking whether there are any recommendations for handling cash. For example, should we oblige visitors to pay by card like some restaurants are doing, or is it okay if using sanitizer, etc.?
It's not legally a requirement.
No, it's
a recommendation, but it's not legally required. If somebody has only got cash, you couldn't refuse.
No, just
wash it out. Well, you can as a restaurant, if it's your business, you can do, but you wouldn't have to refuse them.
Okie dokie, right, just going through the chat. My colleague Julie again's put another link to fundraising regulation guidance on person events, so hopefully that can go out in the information sent out afterwards. Another question, and do bear in mind, people, if you want to ask another question, because I think we are coming to the end of the ones we have, so feel free to say just in chat if you have a question you'd like to ask it, just write question, and then I'll come to you once we've dealt with this one. Or anyone who feels they've asked a question and I've overlooked it accidentally, please feel free to say, I have a question in chat, and I'll come to you after we've answered, hopefully, John Latham's question. He's asking, what advice, please, would you give on restarting toddler groups? For example, how do we ensure social distancing with small children?
Toddler groups, they need to do their own risk assessment. They can go back in an operation now. They're allowed indoor up to 15, and under 5s don't count in the number. So each group needs to do their own risk assessment. So yeah, that he shouldn't have to worry about that. Leave it for them, and then he can look through their risk assessment. If they need advice, they can come to us, but there's plenty of guidance out there for groups and activities for children that they need to be following.
Excellent, thank you. And again, Vicky from Museum of Richmond has just, in response to John's question, has said that the baby group that she went to had people on mats that were 2 meters apart, and when you were off the mat, you had to wear masks.
Yeah.
So I've really started the avalanche now of people. Mike, I'll come back to you because I know your question was quite specific, and I was going to say if you typed it in, I would make sure it got to Helen, but hopefully we'll come back to you, Mike, because I know you said it was quite a specific question. Faye Hamilton, Crossway Pregnancy Crisis Centre. She says they're seeing people face-to-face, clients face-to-face, and they're a drop-in centre. They're currently supporting people by phone and wondered when we could go back to seeing people in the centre in person.
It's a service, isn't it?
Well,
So
they
you can do it now as long as it's risk assessed, yeah, and it's an important service.
Yeah.
Right. And
I mean, there are some services where you do feel they do need to get back. You know, we need these services back. And actually, I think there's some hesitation in some sectors. They're nervous about coming back, but actually, as Maria said, you know, support groups could operate all the way through.
Okay, thank you. And Charity has asked from Hans, who we heard from earlier, has asked a question which coincidentally Jean Hunter has also come up with virtually the same question within the same minute of each other. In some instances, bear in mind they do a lot of support for older people. They're saying in some instances we need to give an arm to an elderly client. So is this okay to do if it's necessary for their safety?
Yes. We're doing face coverings anyway. We want people to be safe. Absolutely.
Yes, yes, and you're side to side as well, aren't
you?
Yeah,
not face to face. Yeah.
Yeah.
Right. Oh, hello, Kay from Leah, Learn English at Home. She's also working with Jenny. Just seeing if there's a question. She's finding this session really helpful, so thank you very much, particularly Helen and Maria. Just checking whether there's a question in there. Kay, is there anything you wanted to say? You're talking about the blended service. Was there a particular question you had, or was it more just a comment about the fact this is useful? I don't want to put you on the spot, Kay, but it would be nice to hear from you if you do have a question. No, just a comment. Sorry, Kay, I didn't mean to put you on the spot, but I've just seen your later one. You're just a comment, but you found it helpful, have you? So she's gone again. Joy. Right, Mike Derry from Healthwatch, you have been very patient. Did you want to ask your question?
Please. Thank you. So Healthwatch normally would go out to NHS spaces, so hospitals, GP practices, and also care homes and places like that, as well as to activities that are organised by other organisations to talk to people about their health and social care experience, and then we use that to drive improvements in the way that services work. Obviously, we're not a support organisation, so it feels like we sit outside of those regulations. I'm interested in when we can start to go back to doing that sort of activity, particularly as it's not really possible for us to control the numbers of people that will be there or to control the social distancing and so on. Obviously, by going into these activities, we're adding extra people into the spaces. So, yeah, really keen on the advice that you can give us about how the guidance works for us.
So I'm a little bit confused how you can't do the social distancing. Is that because you're in another environment and it's different each time, or you're not in the same venue each time, are you?
That's exactly right. So there are always venues that we don't control. We're always going on to other people's activities. Sometimes they're clinical environments, sometimes they're care environments.
So each venue will have their own set of risk assessments anyway in place. So you should be able to do that from the 17th indoors.
Okay, that's great. Thank you very much.
Yeah, I would say, I mean, effectively you're offering a service, aren't you? Are you sort of like a little bit like market research?
Yeah, we've got a statutory duty to collect patient experiences and to make recommendations.
It's a service, isn't it?
Yes, a service. So you're running a service. So yes, you can operate. That's fine.
Okay, thank you. So 17th of March when the indoor guidance kicks in.
You could do it from the outdoors now if you wanted to.
Thank you.
Just following on, again, my colleague Julie, she's really keeping an eye on various guidance that's going out, and she has put into chat as well some guidance that will be useful for John regarding Early Years Alliance have published some guidance on reopening toddler groups. So John, that's definitely one for you and possibly anyone else who's running groups for babies, toddlers, etc. I haven't not seeing any new questions coming in unless I'm missing them. There's quite a lot in chat, but I just want to check with Naomi from Richmond Borough Mind if she is still here, because I know she's put in a couple of questions. I know quite a lot of them have been answered, but I didn't know whether we had fully answered her one relating to results for lateral flow tests and whether anyone's got any advice on being able to get the results from employees to make sure they understand the importance of declaring if they get a positive test. Naomi, was there anything else you wanted to add?
Yes, thanks, Catherine. Yeah, that's right. It was more surrounding how we get the results as an organisation, because obviously I appreciate the ones you order to your home, and even the ones we give out as an organisation, they go through to the government website, but we as an organisation don't necessarily receive the results automatically. So I just wondered if anyone had experience of making it mandatory essentially for us to get staff and volunteers test results, kind of when they're doing it twice weekly. Seems to be a bit of a
well, it's not mandatory, is it? It's just what you recommend. So I mean, it's just about people just cooperating, isn't it, really? Just asking them to provide it. I don't think you can mandate it because it's not a mandatory requirement.
Okay, but there is something about, obviously it is quite good if people do.
I think you would request it. You can request it, can't you? You would be requesting, and you would have thought that most staff would volunteer, because why would they not? But where you go beyond that it's not so clear. So you definitely can request it. You include it in your risk assessment. This is something that we would like you to do. You explain to your staff why you want them to do it. It's for their safety as well as everybody else's safety. But I don't think, yeah, that's at the moment would probably be my best recommendation. Is something that you discuss with people. You know, you have a conversation with your staff about it. This is why we're doing it. We want to protect you, or we'd like to see your test results. We're not trying to invade your privacy. The reason you're having the test result is so that we know that you're safe to be working or volunteering with us.
Okay, because I know the Department for Health and Social Care suggested that we'd need a formal consent form. So I just wondered if the council or if any other organisations had a kind of example or have kind of put this in place before.
See, that's unfortunately, Maria and I, we're not in that sector, so somebody else who might have that information.
We're not aware of anything being produced just yet, but Naomi, maybe that's something that can be taken away, and we can see if anyone else on this call as such has found anything that would be helpful on that front.
If anyone has any links to social care, they might have one already, as you say, we could borrow.
Yeah, it was more just people's experience of, as I say, getting those results as an organisation themselves. So yeah, if anyone has any tips, that'd be great.
Okay, we'll note that one, Naomi. Thank you.
Thanks.
We're coming to the last sort of 10 minutes as such, so I will come to the panel in a minute and check whether Sarah, Adele or Melissa have anything that they want to add, because I know the pressure has very much been on Helen and Maria, but if there was anything else they wanted to add. But we mentioned earlier Friends of Queen Mary's Hospital. Helen, I think you mentioned them as they'd submitted a question. Charles Shipley has written in there that Friends of Queen Mary's Hospital have volunteers on wards, and they also have a trolley service for patients. And he is assuming that it is at the hospital's discretion if we can recommence these services.
Yeah.
Presumably, yes. Yeah, sounds sensible, doesn't it?
Yeah.
So yes, talk to the hospital, see what they want to do. Right, so there's a couple of minutes for any final questions if anyone has anything that they don't feel has been answered or they've just thought of. Can I just check with other panel members? Sarah, was there anything you wanted to add or comment on in relation to this morning's discussions?
No, I mean, we did offer in the previous sessions that we've had to assist with any risk assessments, just reviewing them, just giving any comments and feedback. I got 1 or 2 queries. I haven't had many more. So if people do want any help with risk assessments, we did offer to just provide that support if in terms of just some generic feedback because we have looked at some of the guidance, although I've not been keeping up to date every week, every time to keep changing it, but I am trying to make sure we keep on top of what the current stance is, the same as I'm sure Helen and Maria are.
Thank you very much for that, and thanks for your time today. Adele, anything else from you? I know we had some connection problems and you did finish off what you were saying in the chat, but I don't know if you can connect now and whether there's anything else you wanted to say.
Yes, apologies for the connection problems. I'm not sure what happened there. Yeah, just if anybody's got any queries about particular buildings, feel free to drop me an email. Quite happy to answer anything, and if I have any updates about changes or any information that I might find useful for this group, I'll forward it on to keep people updated.
Thank you. And in case anyone didn't see what you'd written in the chat, just to confirm, you'd said that you will know more about what's happening in terms of Sheen Lane continuing as a lateral flow testing centre at the end of next week, I think, or is it that the LFT is ending next week?
No, I'll know what the position is on it next week. Kevin was kind of very much focused on the MTU testing at Wandsworth, so because we had to kind of do that every day, 7 days a week the last 2 weeks. So now that's finished, I think we can review what's happening with the lateral flow test.
Right, so there'll be more information. I know Simon Lawson at Systems Advice, and I think there's one other group as well that was interested in what's happening with Sheen Lane. So that will be certainly good to find out. So thank you, Adele. Hopefully we can share that information when it's available. Melissa, is there anything else you wanted to add?
Thanks, Catherine. No, nothing from me. Thank you.
Great, thank you very much. Are there any final questions? Normally these sessions do end a bit early, I'm aware, because I've been on one before, but it's been really good how people have been willing to ask questions, and we've had a bit of a discussion. I think that's been really helpful.
Catherine, sorry to interrupt. I can see 2 people with their hands physical, they're real hands. So there's Susanna and I think it's a lady who's, I think it says John, but she doesn't look like a John, but I don't want to to unmute. Oh, no, Susanna, I think you've unmuted Susanna.
Yes, I'm from the Twickenham Museum. We are the very small space, and the answer was get someone to pop down and visit.
Yeah. My colleague Sean, I can get in touch with you after if you want to give me the details. Either myself or Sean Case, who works predominantly in Richmond and knows the area really well, might be able to pop out and see you about that.
Okay, that's fine. Thank you.
Okay.
That's helpful. I know Sean Case actually has been helping a number of groups. He is well known among some groups now. And I know his support over the last year has been really helpful. So I think that's a really good opportunity for you, Susanna. That's great. And thanks, Ellie. Who was the other person? It was John. It was John.
John is obviously not John.
Like to say who you are.
Sorry, I'm Stephanie Collis. My husband was using the computer last night and left his name on it, so sorry about that. I'm from the Richmond Aquaphysio group, and we offer aquaphysio exercise at Teddington Hydrotherapy Pool to people suffering from, quite often from long-term conditions, sometimes from sports injuries or recent surgery. What I wanted to ask you, please, was we have a very concerned member of the committee who wants to know whether or not we can insist that members have vaccination prior to returning to the pool or not.
No.
Thank you. I thought that would be the answer.
Yeah,
it's good to have somebody else's response to it. Thank you.
I mean, if you socially distance and you make arrangements within the changing rooms and all your
ventilation in there. Yeah.
Yes, we will. Yes, we will be following all of the pool's guidelines and requirements and conditions of returning to the pool. Obviously.
And do you use the pool independently, your group, or is it shared with other groups at the same time?
No, it's purely our group, and the numbers have been reduced, whereas we used to have, in the normal way of things, we would have had a maximum of 8 members attending a session. The pool have reduced those to 5 people per session.
So they've obviously risk assessed and
they'll be socially distanced and led into the pool by the physio, and then socially distanced and led out again at the end of the session, etc. So we'll be following all of those guidelines, but we just have one particularly anxious committee member. I can reassure her that we cannot insist on it.
No,
yeah. Okay, thank you very much.
Thank you, Stephanie. Yes, we're getting to the closing bit. So a couple of things from Mike Derry at Healthwatch. He has asked if when details are sent out, we can have the contact details for who to get further support from. So those people who've made kind offers of please get in touch with me. I know Adele and Sarah said that. If their email addresses can be included when the slides go out, I think people would find that really helpful. So thank you. And Mike has also asked a question, which I think actually is probably relevant to a lot of us. The roadmap was very vague on when we can return from working in the office. Now, I know that it is said you have always been able to go into the office, but there's still that guidance about where it's possible to work from home, you should. Does anyone, Helen or Maria, do you feel you've heard any more about when people can return to the office? Anything you'd want to add on that?
No. Well, we're following the government guidance, and it is at the moment still work from home where you can.
Yeah.
But I mean, people do go into the council offices, and sometimes you just need a one-to-one meeting, or some people, as I said, there is also an issue of people's mental health. It isn't you are allowed to go into an office, and if you have somebody who's
some organisations, you can go back into the like for example, I've been back to help with citizen advice, getting them back safely into the office because they really need to be there to offer their services. So some offices will need to be open, and you can do that quite safely as long as you review everything and make sure you put the control measures in place, like your sanitising stations, your one-way systems, your floor marking, social distancing, ventilation, etc. So yes, you can do that depending on what it is. But if you can still work at home, you're advised to if it's safe to do so. Yeah.
And we definitely don't feel that people should be compelled to go back, which is the other way around, compelled to go back to an office. Obviously, we're not at that point yet. Hopefully, we'll never get to that point, but there you go.
Right. Okay. Thank you very much for that. Right. We're going to leave it there then. So I would like to particularly thank our panel as such, particularly Helen and Maria. Helen for doing the presentation, and obviously both of you, Helen and Maria, for answering lots of questions. And also thank you to our other panelists as well, Sarah, Dennis, Adele Casey and Melissa Watson. Thank you very much for answering questions and for your time today, because I think it's really helpful to have that range of expertise and knowledge to hand. I know I can see from the comments coming in, people have found it really valuable to have the time to be able to ask questions and hear the detail. We know everyone's still learning as we go along, and it's an ever-changing picture, but I think I really do find these events, I think, are very welcome by the sector and have a chance to sort of discuss things. And CBS is very keen to help sort of facilitate these discussions. So, and we'll take on board the point about being able to share peer support learning as we go on. And so also thank you very much to Ellie for helping to make this event work smoothly today. So thank you very much, Ellie Firth. And thank you very much to all of you voluntary sector colleagues for attending today. It's so lovely to see you all again. And thanks for your time, and do please keep in touch, and any other questions, do contact those who've put their contact details in the chat, and as I say, slides will be sent out. We'll keep the conversation going, and I'm sure we'll meet again at some point soon. Okay, so thank you all very much. Have a good afternoon. Bye-bye.